This is our 50th podcast. So
Season 2.
I think something that's really important for patients to understand is that the process in the States is different than it is here.
I never thought about having our own agents.
No.
And it just kept on getting bigger and bigger. And here we are. And we're super blessed to have you guys on the team.
Thank you. Glad to be here.
Thank
you.
We're blessed to be on this team.
We are blessed.
Thank you.
Absolutely.
Thank you. The patients that are out there know that we will stay late if it's needed. It's more because we want to perfect what's in your mouth and you can get your full money's worth and more.
Yeah.
How come my clinic said they could do it in a day?
Yeah, how come my doctor said that pterygoids are bad for you? Well, because he doesn't do pterygoids. Oh, that's the secret. Yeah. So I don't sell tacos, so tacos are bad. All of the numbers for our doctors are on our webpage.
Yep. And on Google, that's all
Everything is there.
Code and everything.
Transparency. There's big things coming, guys. Things that you guys know about, things that you guys don't know about, things that you don't know about. And we're always working to become better. Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. My wife and I are the owners of Supreme Dental Clinic. Remember, this podcast was meant for you, our patients. Don't forget to subscribe to Spotify and Apple Podcasts so you can listen to our beautiful voice. Guys, this is our 50th podcast. So
Season 2.
For all those patients that have that come in and say, hey, you know what, we've seen your podcast. You guys do make a difference with them. We thank you, and we're still standing. We want to welcome the Infinity Stones. We have Jessica. We have Lucely.
Hi.
We have Ernesto. We have Luis. And we have my beautiful wife, Aida. So today, guys, obviously, we're super happy. 50th edition, 50th podcast. I want to talk about something that we hear every single day, okay? I want to talk about the patients that...
Wait, can I say something before anything?
Go for it. Yes, great.
Okay.
Can we cut that part off?
Well, I want to say I'm proud of you because now that I'm here, I can tell you that this is really hard. I'm sweating right now. So every time you tell me, oh, I'm not ready for the podcast, I don't know what to say.
Yeah.
I'm not going to criticize you.
Thank you.
Okay? I'm going to cheer you.
Thank you. And if you happen to criticize me again, you're more than welcome to come back. And we'll put you on camera.
So, yeah.
Thank you.
I'm really proud of you.
I take that. I'll take that.
Okay.
And make sure, can we put that on the reel and like send it to me? Thank you.
repeat.
Appreciate that. Everybody's wearing cool gear today,
Yes.
except Ernesto. Thank you, Ernesto.
It's in my heart.
Yeah, and I had to wear cool gear right here too. You got that right there too?
Yeah, buddy.
Dang. But we're going to talk about the expectations that sometimes our patients happen to have. The things that are not really realistic time-wise, and they don't really realize that. You know, maybe they've seen a video on TikTok, a podcast, Facebook, Instagram, and then they want us to fix the world in 3 days. Who starts this one?
Oh man.
Who's feeling brave?
We've got some stories.
Who's feeling brave? Ooh, there you go.
I'll start.
I'm your huckleberry.
Let's do this. So, there definitely are a lot of misconceptions, misplaced senses of expectations when it comes to dental work. I mean, a lot of it, I'm learning as I go along, right? But there's so many layers and processes involved to what the dentist and assistants, the lab are doing. Depending on things, one thing depends on another, and if anything gets delayed in that process, that can potentially move out or push out your treatment plan. So, for example, for all on fours, now I know what we asked for 5 days, right? Because things can happen, and surgery can take longer. Something might come up, the lab might take a little bit longer. Maybe the dentist wasn't too happy with the implant, and so, we'd rather give you guys a realistic expectation than have you come down, spend your time, money, and energy and resources, only to find out that you're going to need more time than you were originally told.
Can we do it in 3 days? Absolutely, we can do it in 3 days. We can. But do things sometimes happen? Yes. And do sometimes we look at things and we want to make them better? Yes. And is this going to be better for us? Yes. Is it going to be better for you? Absolutely. We're not telling you stay 2 extra days because we feel like it. No, it's because the patients that are out there know that we will stay late if it's needed. It's more because we want to perfect what's in your mouth and you can get your full money's worth and more. That's why we're doing it.
Yeah, we're going to do it, but we're going to do it right.
The other thing, too, though, is I think that unrealistic expectations start when the patients are at their hometown doctor. And unfortunately, they're given a treatment plan that is not the best treatment plan for them. Because it's coming from a medical professional, they think this is it, this is what I need. But they're not looking at the fact that their financial coordinator in that office is looking at their insurance and what it covers. Maybe an implant is the best treatment for that tooth that's missing, but they're only going to quote you a bridge because your insurance doesn't cover that $6,000 implant that you're not going to fork the money over for. So when patients call us and say, I'm sending over my treatment plan, I want to know how much it'll cost for the doctor to do that, the doctor is not going to take orders from your doctor. It's kind of an insult, in my opinion, too. You're asking somebody to just take over somebody else's work and say, this is what I need. I just want you to do it cheaper. And so I have a high respect for the doctors that work at Supreme Dental, and I feel terrible relaying that to them, saying like, hey, this is what they want done. This is the list. It's like, no, our chances are that, and not to knock anybody else's, clinic, organization or whatever, but chances are Supreme is going to have better technology that's going to have they're going to be able to come up with a better diagnosis for you, and they're going to come up with a plan that makes sense and it's going to address the big picture and not just the treatment plan.
3-to-1. Actually, our doctors, and as you guys know, they travel around the world to be able to to do the best for the patients, and they carry around their little books, and they're always studying and they're always trying to get better, and we're always trying to get better. When you guys were down here, we had somebody from Strawman joining us. You guys know that we're working on different things for the lab, for Supreme Dental Lab, and there's always something else, and we're always working. My wife and I are always thinking like, what if this? What if that? Mm-hmm. What if this? What can we do better? We talk to our doctors. What else? What else is out there? Well, there's this. I've been really looking into this. Okay. Well, the pig dental. Well, let's bring the CEO. And he actually was awesome. Yeah. And, but yeah, no, definitely. That is definitely a fact. Who else is feeling brave?
I am.
Ooh. All the way from Cancun.
Yeah. Well, it has to do with trends on social media because I take care of patients on Instagram and Facebook. So they see something they like and they say, I want that. And there's nothing wrong with that. I mean, you want to have that beautiful smile. You want to, I don't know, have your Instagram photos taken and all. But sometimes we ask for photos. Almost every time we ask for photos. So our specialists who have all the knowledge and everything can pre-evaluate them and give them something realistic for them to have, something that will not only enhance their smile on the cosmetic side, but also they will be able to have a long-term solution. And they seem to just say, no, I don't want that. I want this on this photo exactly like this. But maybe your face is not exactly for that smile. They want to do something customized for you. And again, it's like, no, but I want that. So the best we can do is to just ask them to come, for them to meet the doctors and actually see what's best. And it's sometimes really funny because even if we have all the proof, like the best thing to do is just fly in and be evaluated. It's like, no, they bring the photo and everything. So it's, in a while after we talked and everything, we explained why is it best to do what they exactly need, and they go for it. But it's amazing how a photo can really just take you exactly there, and then you don't see anything else. You don't see past that. And yeah, after having all the right info, then they go for it.
Have you guys ever seen that video of that green cream you put on your face and then all the blackheads come out?
Yeah.
You guys seen it on social media? You put something there and then all of a sudden, dude, boom, all the blackheads.
Right.
That's not true. I looked it up. I wanted it. And I was like, I want that. And no, it's not true, and that's the thing. We see in these trends, I seen one that it's like a grill that you buy that you put on and it fixes all your problems.
Oh yeah, like the click on
veneers.
Yeah.
Ain't that awesome? Click on veneers.
Yeah.
How come my clinic said they could do it in a day?
Yeah, how come my doctor said that pterygoids are bad for you? Well, because he doesn't do pterygoids. Oh, that's the secret. Yeah. So I don't sell tacos, so tacos are bad. So
What?
what's going? Yeah, I thought we were brought in here for tacos, Frank.
I haven't had tacos yet.
No, it's you, bro. We're both looking at you, Luis. No, he already did it first. That was you.
What's up, man?
Oh, you guys are waiting on me. I thought Ernesto was going to say something.
He's the first one.
Yeah.
No, he heard tacos and he wanted to jump at it.
Yeah, I lost my track of mine as well. No, I think it's best to set an expectation, when we do tell patients, we're going to need you for 4 days, we're talking 4 full business days.
Mm-hmm.
The 5th day, we're going to ask you in case something were to come up. It's best that you have an extra day in case we do have to do an adjustment. In case we finish, you go have breakfast, and while you're having breakfast, you feel a little rough spot. The numbing agent's gone. You need that adjusted. You're already here. You walk in. It's not going to cost you a dime to walk in and have it adjusted. Where, if you're wanting to show up in Phoenix, at noon, we're going to pick you up. You're not going to get to the clinic till 3. You certainly can't plan to go home Wednesday afternoon. It's just not going to happen. It would. People would have to bend over backwards, pull all-nighters, and it just, you rush things, and they say that things that are rushed often don't work out.
And you know what? We were just talking about it yesterday that the patients that we do bend over backwards for.
Sometimes it just turns into a slight nightmare for the patient and maybe for the doctors,
Mm-hmm.
Yeah, a lot of the times we bend over backwards for a patient, and then the patient,
He's never happy.
they're not happy. We work to 11, 12 o'clock at night. The next day, super early, got them in and everything, and then something happens.
Welcome to Dental Facts. Approximately 75% of school children worldwide have active dental cavities. You heard it first at Supremedental Podcast. Floss, brush, and keep smiling.
They're the big thing. So in the medical world, and I've been to a lot of doctors when I was younger. I'm asthmatic, so growing up, I was at the hospital all the time. And when you go to an appointment, there's appointments that for basic stuff that people are very fast, and then there's appointments where you gotta wait just a bit because they're seeing someone else before you, and there's no time limit. But rest assured that when it's your turn, we are gonna take whatever time that is needed to make sure that everything is done perfectly. It's not like, you know what, John, you're gonna have to get up. 30 minutes is over, buddy. We're halfway through the implant, but we'll work on you tomorrow. No, it's not gonna happen.
Yeah.
So, and there's some patients that totally understand. They're like, hey, you know what? We just want everything to be done right, and we know this is the place to get it done. And then we have other patients that said, I've waited 35, 45 minutes. I hate you guys. I wish you guys burn. And we're like, but you have a full month restoration. It's perfect. I know, but you made me wait 45 minutes.
That's the one focus, right? Now, I think the majority are on the positive side versus
Right.
versus that, you know, but you get the one that is upset because they had to wait. But I think something that's really important for patients to understand is that the process in the States is different than it is here. And then also people are coming in from all over the place with we can only go off of what they're telling us. Like when we send up the appointment for the patient and we're like, hey, this patient needs a couple crowns and a couple root canals and wants to address a few things. It's not like we, in their mind, and I'm assuming it's not an overhaul. You guys get in there, come to find out they haven't been to the doctor in 30 years. They've been avoiding it, and they've got tons of mobility, and all of a sudden it turns into an overhaul. Of course that's going to take longer. Of course that everybody that is after that person is going to get pushed down, but they're getting the attention that you guys pledged to give them, and it's their full attention, full everything. When your turn comes, it will they will treat you the same way. It will be the same exact attention and everything, and they're gonna do what's right for you, just like they did for the person before you. That's what's happening behind there, you know, and everything. So, I think that's really important for people to understand. We're also not waiting on insurance to approve your stuff. We're not doing all of those things. Back in the States, I know that if I want to get into an eye exam, they're 6 months out. Eye exam.
Right. And, you know, we have a lot of in-house also. So if you need a root canal, you don't got to go to the root canals,
right.
The root canal specialist office and then do an appointment there. And then an implant, everything is here. So it's going to be hard for you to hit us with something that we're not going to have here.
Right. Very little that cannot be handled here at Supreme.
And what we can't handle, we're working on it to be able to handle it.
It's coming.
In the office also, we have coffee. We have different types of coffee. We have water. I think you had tea at some point.
we got tea.
We had tea.
That was thanks to Nomi.
Nomi wanted tea.
Yeah, I wanted tea.
Manny wants Reese's Pieces, but that's not going to happen. We have also Supreme TV that you guys are able to watch and see all the cool reels and all the different trainings that we've done and learn a little bit more about us before you make the decision, or even after you made the decision, inform a little bit about us, so then you could tell the world and feel better about the decision that you made. One of the qualities here that we have is that we're very transparent, and everybody who works here, I expect the same, including the Infinity Stones. Like, we need to be very transparent. We need to let the patient know, hey, this is what we see, this is what you can get, and this is what could happen. And this is why we're making this choice, and these are your different options for you. And yeah, sometimes the patient comes in and says, I want an all-on-4 top and bottom, and it's going to give me $4,000, $5,000, $6,000 more than me saving their teeth. But it's not right, you know. We had somebody 2 weeks ago that came in super young, maybe 26, wanted to pull out all his teeth. And I think it was Dr. Alonzo who said, no, man, I can't do it. He's like, I won't do it. And he asked me, hey, can you come help me real quick? And I talked to him, and I talked to his father, and he understood, and he walked out of here with a beautiful smile. So, you know, it's something that we work on every day to be better. But we do hear those stories. You know, and Ernesto, you got a cool little story for us. I don't know if you want to let us know about that. There was a patient that came into our clinic, and can you tell me more about that?
Yeah, so there was a patient that had reached out to get some work done,
Mm-hmm.
and like most, he came down and did a couple of consultations with some clinics in the area. And so he came in, had a good time, good consultation. And He was very respectful. Let me know, hey, I decided to go with another, clinic. Didn't tell me why or anything like that. So, okay, yeah, you know what? Hopefully, I said if you need this in the future, we'll be here for you. Well, I think it was the first or second day that we were here, I received an email from this individual asking me for forgiveness and apologizing for not going with us to begin with, because the clinic he chose became very aggressive. He's not even sure if they did the work that they said they did. They charged them for work that hadn't even been done, which we don't do. I said, hey, you know what? Thank you for letting me know all that, because we always want to get better. And if there's feedback for myself or the team, is there something we could have done better to earn your business right from the get-go? And he admitted to me that he made his decision based off of looks, based off of looks, because the dentist happened to be easy on the eyes. But
she was she was a female, right?
Female, yes.
He said she was hot.
He said she was hot.
Those were the words.
Yeah, but he came with us, and I think it was a male doctor that seen him.
Yes, it was Dr. Ivan, Dr. Spooky.
So Dr. Spooky seen him. So Spooky, step up your game. Get a wig. So this patient went somewhere else because the dentist was hot. And now his teeth is not. And now he's literally asking for, it was weird because you were reading it to me and it was like, please, like, accept my apology. Please take me back. Like if you were his ex or something,
Yeah. Yeah, no. And I said, there's no need to apologize. And he even called me again today saying, hey, I'll sign a contract with you guys. I'm not picking anyone else. I'm like, look, I appreciate your confidence, but there's no need. That's not the way we operate. We spoke again about how, like, hey, we'll come in, take a look, see what was done. And, I will let you know that if for whatever reason the work that was done wasn't done to our standard, we will start from scratch, because we won't work on shoddy workmanship. It's not fair to you. It's not fair to us. And that's not the right thing to do. And so we're going back and forth, and he's going to come in and once he gets everything in order and give us an opportunity to fix his smile. And so, we want patients to know. We know it's a very, like that one patient that came in about the emotional roller coaster. Mm-hmm. Yeah. There are a lot of emotions.
Mr. Granger.
Yeah, Mr. Granger. So there are a lot of emotions. So if you happen to come in and you're waiting longer than expected, we know it's easy to go out, go for a walk. You're upset. The emotions are high. The pickers are going to, tell you sweet nothings. And, it's easy to go and check it out. Just what we ask there is, think about the rapport that you've built with all of us, the trust. We've earned your trust. And, kind of just take a step back and keep that in mind, because, again, you're upset. Things are not going the way you thought they were going to, but that doesn't mean when it, your turn comes to the chair that we're not going to take care of you. We're absolutely going to take care of you and do things the right way.
Think about when you walk out of here and you walk into another clinic and they don't have patients waiting. Why don't they have patients waiting?
Red flag.
Why isn't nobody in the lobby?
I think that, Algodones, I lived on the border all my life. And so, like, Algodones has evolved to where it used to be a little town where all these businesses relied on the pickers, and people would just walk across the border and say, I'm just going to go find wherever I, see where I land, and I'm just going to look around and talk to a few places. And I think there's, some people that still do that. Maybe people that are really not on the internet and everything. But in this day and age, like, there is no excuse for no research. Now
we have stoves and we don't light a fire in the woods neither.
Right.
Things have really evolved to the next level, actually. So I'm excited to hear these things, because these are things that we hear about all the time, like all the time. Patients coming in and they were told something else. We have places that say they have the pig dental, and then we research them a little bit more.
And they just have the software. How does that work?
That was cheaper for sure.
Yeah, I wish Adriana and Nanda should have told me about just buying the software. So
I wish we knew before.
I guess we've been doing it all wrong.
Yeah.
I've heard about. I've heard it all. I've heard a little bit about. I've heard about patients saying, "Look," and I'll say this straight out. If somebody says they're ADA certified, then they should have their ADA number on their webpage. It's not a social security. They got nothing to hide. We're ADA members. Wait, does that mean one of your dentists is ADA members that probably expired last year, and that's why you don't want to put the number out? Because you guys are 4 or 5 guys. All of the numbers for our doctors are on our webpage.
Yep, and on Google, that's all
Everything is there.
Code and everything.
Transparency.
The dentist PDF that you put together has the numbers on there, I believe.
Oh yeah,
Right?
Yeah.
With their pictures, so you
Yeah.
can. When you walk into the clinic, you can see the doctor and see you can see it all matches up. I mean, there's nothing to hide. There's not like something here that we're like keeping from everybody. Ooh.
Yeah, I mean, our reviews are real, guys. We're not going to have 3,000 reviews come up in 3 months. That's not going to happen.
What?
I know. We work on all our reviews.
We crunched the numbers, and it would have been impossible.
Oh
for
my
sure.
gosh.
I would, yeah. If it could have been done, I would have done it. But but it's not possible. And guess what? Not all the patients leave reviews. So, staying true to ourselves, our patients see that. And when somebody, I've been on a reception when someone's upset about whatever the situation might be. Maybe it took a little bit longer to see them. Maybe their estimate's higher than what they thought, but they're not really mad at me. They're mad at themselves because they didn't know they had to pull all their teeth. And they're like, I let myself go to this point, and they're just mad. And there's other patients around in the reception that they're like, hey man, you're in the right place. Like, these guys are going to take care of you. Like, our own patients are our cheerleaders.
Oh yeah, it's a community.
And you can't pay for that. And I know people say that we're on top because of advertisement. Advertisement doesn't get you the Pig Dental. Advertisement doesn't get you our own lab. Advertisement doesn't get you guys to be able to be part of us or 16 years here. You know, advertisement does bring patients in, but it doesn't mean the patients are going to stay if you suck.
Advertisement doesn't pay for the skill set our dentists have.
For 8 international accreditations, more than any other clinic in Mexico's history.
Okay, you could stick any of those guys and gals into a classroom. I mean, they're the way that they taught us during the master classes the last 4 days. It's like they're professors.
So Dr. Elias knew about the master class on Saturday.
Oh,
Before he had to do it on Tuesday. Dr. Elias knew about it. I mean, Dr. Alonso knew about it on... Dr. Elias knew about it on Saturday. Dr. Alonso knew about it on Sunday night. Dr. Dulce knew about it less than 24 hours before. And I told Dr. Michelle yesterday. Because I didn't want them to be like, oh, let me prep up a presentation. Dr. Elias was going to do it, but he forgot his laptop. I just wanted them to do what they do. Because that's the best masterclass. Like, they gave you guys what they had, and you guys are like, whoa, I didn't know about that. Whoa, I didn't know about that. My wife was like, whoa, I didn't know about that.
We even had one with Dr. Mitch, and that was really random because he was just sitting down, had just finished breakfast, and Luceli started drilling him, and he was just back-to-back answers. So he had absolutely no time to prep.
Yeah. Right. And that's what you expect when you go to a medical facility.
Certainly.
Like, why am I getting an implant? They don't say, well, let me look that up. They're like, oh, you're getting because of this, this, and this, and this, and this, and that's who you want them working on your mouth.
yeah.
You know, just plain and simple. I tell George, hey, George, I need to record this, this, and that. He doesn't tell me, well, how do I record it?
I mean,
He might tell me, what song do you want me to put? Yeah, I mean, he does do that from time to time. But besides that, I'm like, hey, man, make it work. Like, use your vision, surprise me. And I think that's what, like, I'm expecting the best from you, surprise me. And he's just like, well, Frank, surprise me. And he sometimes surprises me in a good way. So I want to thank you guys for being here. Once again, this is the 50th edition of Supreme Dental Podcast. This was done, we started this a little bit over a year ago. And this was, my wife had told me about it a while back. And I said, no, I don't like podcasts. And then we were driving to Vegas from where? From LA? From LA.
Yes.
I'd never taken that road, and it was snowing for the first time like in 15 or 25 years in that place. So traffic was slow. I was vulnerable. And then George just sends me an audio. Hey, Frank, I was seeing this podcast, and I think we could really pull it off, and I think we could do this. And my wife's like, yeah, let's do it. And then I said, yeah, come on, let's do it. Yeah, why not? And then I'd never seen a podcast before. And that's when it really hit me. Like, I mean, I could talk for days, but I could talk about the things I believe in.
Certainly.
So I believe in what we do, so I could talk about all about it. But it is tough, and sometimes I'm just like, I really don't feel like doing a podcast today. Like you said, I'm like, you know what? I don't know what's gonna happen. And then I get here and I tell George, I don't know, man. I don't feel like. George is like, come on, man, let's do it. Come on. And then it just comes out, and it comes out beautifully, because this is what we do. We could talk just like the dentist, the master classes. They could tell you. The root canal specialist, Michelle, she's like, we could be here talking all day.
Yeah.
You know, I literally had to almost kick her out because we wanted to do the podcast, you know, and she was all about it because she loves what she does. There's dentists that are made dentists, there's dentists that are born dentists, and I could easily say that our dentists were born to be dentists. And that is nothing publicity could purchase. There's big things coming, guys. Things that you guys know about, things that you guys don't know about, things that you don't know about. And we're always working to become better. So I want to thank you guys for being part of that stepping stone, being part of Supreme. I never thought about having our own agents.
No.
And it just kept on getting bigger and bigger. And here we are. And we're super blessed to have you guys in the team.
Thank you.
Okay.
Glad to
Yeah,
be here.
thank
Thank
you.
you.
We're
Well,
blessed to be on
congratulations.
this team.
Yeah.
We are blessed.
Thank you.
Absolutely.
Thank you.
Absolutely.
George, if you want to step in here real quick, we want to thank you also for being here. This is your 50th podcast you record with us.
May
Rocking-
was what, 100 episodes?
This,
For the 1 year.
No, this is their one. Yeah, it was
1
1 year. This is their
In the
50th
year.
episode.
Yeah.
And you're rocking also a new hat from Supreme. Looking good.
Thank you.
And we're still waiting from those reels from Singapore
From Singapore.
because he wants to punch his ticket to
Mykonos
Mykonos, Greece. That's where he
Yes.
wants to punch his ticket to. I think you want to go. I'm not sure.
and Vegas.
Okay, I'm not sure.
In Vegas.
In
January is Vegas.
Vegas is my second home, so
Vegas. And then Mykonos. And I think he wanted to go to New York. I don't know what he wants to do.
if you want a family session free,
Oh, he wants free family. What we got to do is take him to New York.
He's on
That-
you
the
want?
that's all?
Only if you want.
Wow.
So thank you so much, man, because you've been,
No, thank you.
obviously you had done this before, but to another level. You pushed this to a whole different level. And we appreciate you also.
No, thank you. I'm blessed to be here with you guys.
Yeah.
Thank you.
Cool.
It's been a
Well,
pleasure.
thank you so much. This has been Supreme Dental Podcast Studio, powered by Supreme Dental Clinic. And just like your infinity stones here, keep on smiling.
Bye, Lee.
Have a good one. Thank you.
Bye.